Hello, my name is Anna Harden. The poster I'll be presenting today is titled Teach Back. The clinical problem that I chose to address is acute care nurses working on medical units. Does the learning and implementation of an evidence-based teaching method compared to a non-evidence-based teaching method affect the nurse's perception on their teaching experiences with patients? The background and significance for this revolved around developing an evidence-based approach to patient education to ensure that patients comprehend their self-management plan of care. McAfee in 2012 explains that several barriers can influence patient outcomes, such as patient-centered education or lack of adequate symptom management, poor medication maintenance, and inadequate treatment compliance. Negarande and Associates in 2012 state, "It seems that using simple strategies to ensure that patients have learned what is taught to them has a great influence on maintaining the concerned outcomes." The purpose of this project is to increase the nurse's conviction and confidence related to patient education. Without proper understanding of the information given by the nurse, patients are at increased risk of complications and medical errors which lead to unnecessary readmissions to the hospital. Kornberg in 2013 explains Teach Back as empowering the nurses to verify understanding, correct and accurate information, and reinforce medication teaching and new home care skills. Teach Back is a valuable, easily understandable, and effective strategy that supports staff in providing safe, high-quality care with patients and families. The synthesis of literature involved 8 research articles which were synthesized and used to validate that Teach Back was worth pursuing for implementation. 3 of the most significant articles for this project are listed here on the poster under the synthesis of literature and their findings. The project implementation. This project started with the patient care manager and clinical nurse specialist on the 5th floor at the University of Kentucky Hospital, identifying that there needed to be a more effective way to communicate with patients. Through research and discussions with the Director of Patient Education and the Director of Nursing Practice, Teach Back was identified for implementation. The patient care manager then set aside staff meeting time for the educational rollout. The patient care manager then invited the staff to attend. A web-based training was sent to the staff for preview before the educational sessions. The educational sessions involved first, a brief review of the web-based training module. Second, a viewing of the video of Teach Back being used in the clinical setting. 3, a question and answer portion to help clarify the information being given to the nurses. 4, a review of an observational tool. Then the groups of nurses broke into 2 or 3 and practiced using the Teach Back concepts learned. The nurses had to use Teach Back to instruct each other how to prevent falls by using the Call Don't Fall patient care initiative that's being rolled out here at University of Kentucky Hospital. After that, the checkoff was complete. The observational tool was signed and returned to the patient care manager. Upon exiting the educational sessions, a Teach Back handoff was given to each nurse to reinforce the 10 steps of effective use of Teach Back. The project evaluation showed strengths of research supports the use of Teach Back in the clinical setting, which is most important. It was easy, it was cost efficient, it was easy for the nurses to understand and place into practice. The educational sessions gave a visual of the process and time for hands-on practice of Teach Back. The challenges that still exist are reinforcement needed to maintain a change in practice, continued competency follow-up, and to assess specific teaching opportunities and identify key elements for use with Teach Back. Any questions at this time? I really appreciate your time and thank you for listening to my project on Teach Back.